And what is the pathway usually when you diagnose a patient with a cancer? What are the waiting times for treatment or post-treatment? So what is the pathway?
I think that's the good question you have asked now. Most of people, I think, once they have the doubt of the diagnosis of cancer, they have so many fears in their mind. So cancer diagnosis is, they'll think that is a death sentence. It's not a death sentence at all nowadays. First thing is, the primary care physician should give the proper guidance to them, go to a good center where they can get the proper diagnosis, proper staging and proper treatment. In India, I think if any patient comes from remote village or remote town, they can reach any cancer center within one day. Immediately, once they reach the cancer hospital, we'll see the symptoms, we'll see their primary investigations.
Sure.
Based on that, we'll do some basic confirmatory test. Initially, they have the only doubt of the diagnosis. But once we see the patient, so we have to confirm that most of them, they have the doubt whether really do have cancer or not. So we'll do some basic investigations like biopsy. So we'll do the biopsy. Once we get within 1 or 2 days, there is no waiting period in India. They can go to any center. All these tests are done within 1 to 3 days. The first thing is, we'll do some investigations to confirm the diagnosis. That is a biopsy. The second one is, we do some investigations to know the exact stage of the disease.
Sure.
Whether first stage, second stage, third stage. So that is a simple, again, imaging, we'll say that one. Imaging, we have the CT scan. We'll get the appointment within 1 day.
Sure.
Only thing is PET scan we'll do. PET scan means, I think FDG PET we have nowadays is a whole body PET scan. That can be done in a nominal price in India now. Within 10,000, they can get the whole body PET CT. And that they have to be in the fasting, so that can be done next day. So ultimately, all these investigations to confirm our stage of the disease. Once we know this diagnosis, stage of the disease, the next one is plan of treatment, what to do next. So then again, we'll have most of the centers, we have the tumor board. So tumor board consists of medical oncologist, radiation oncologist, surgical oncologist, radiologist, pathologist, nuclear medicine physicist, all the specialties, they'll sit together. They'll discuss about this case, what we can do next.
About, of course, like MDT.
Correct. Multidisciplinary tumor board, we can say. So once we have that type of tumor board discussions, we can do the justice to the patient. Whether the patient will go to the surgery first or chemotherapy first or radiation first. So because all the departments will involve in decision making, even sometimes we'll invite the patient also, really if the patient is willing to discuss. But of course, most of the patients, they're not willing to come to these boards. But we'll share the information what we have discussed in the tumor, my MDT.
Sure.
And we'll inform them. So what is this is our opinion. Do they have any challenges to take the next step in the form of treatment, either surgery or radiation? And we'll, at the time of counseling, we'll take opinions of the not only individual patients. We'll talk to the whole family members. Here, Indian context is the family support is most important. So because they may not prepare to stay in the hospital for 1 week or 10 days for the treatment's sake. So we will give them sufficient time to take a proper decision. And another thing in Indian context is financial issues also may be there. So I think whether they are prepared mentally for the financial issues or not. So the counseling takes minimum half an hour to 1 hour. So we'll sit together, especially the primary care physician, the medical oncologist or surgeon or radiation oncologist, they sit together with the patient and their family. We'll discuss the plan. So this is our plan. So do you have any concern or any limitations? Most of the people, they'll say, we'll go and come back. Because 1 or 2 days, they have to prepare their family at home. And they have to come back to the hospital. The second thing is, again, the financial issues. Luckily, in India, now we have the state-sponsored insurance. In Telangana, Andhra, we'll call it as Aarogyasri. In central government, they have something like an Ayushman Bharat. So under these policies, the patients will get the minimum basic treatment at free of cost. So with that, I think we are able to provide the basic care of each and every cancer patient and we'll counsel them. If they need any extra money or extra cost, again we'll give them some Chief Minister Relief Fund one letter. The letter will go to the something like the Chief Minister office. Is it really justifiable? They will also give the extra amount other than this package amount of state insurance policies. So in our center, we do even bone marrow transplants, and we do surgeries, and we do kidney transplant, heart transplant, lung transplant at free of cost in our center. So the government has so much of willingness to participate, spend money on this issue. So they have taken it as something challenging program. Successfully for the last 4-5 years, we have been doing this, all the transplant under this Aarogyasri program in Telangana and Andhra.